Good afternoon and welcome to this meeting of the Council of Governors of Lincolnshire Partnership NHS Foundation Trust. My name's Kevin Lockyer and I'm the Trust Chair. Routine business first. Apologies for absence. We may have had some. They will be recorded in the minutes of the meeting. Declarations of interest. I have an interest in item 4.2 and so do my non-executive colleagues Di Bailey and Tim Harry. So all three of us will absent ourselves from the meeting when we get to item 4.2 on the agenda, at which point Debbie Abrams, the lead governor, will take the chair. I'm not aware of any other declarations of interest other than those previously recorded. So if anyone has any, can you pop something into chat? If there are none, and just a quick reminder in terms of protocol, it's already been put in chat, but if colleagues have got comments or questions at any point, can you pop a C or a Q in the chat bar, and also can colleagues also keep their cameras off unless they're about to speak. So thank you very much for that, and microphones muted and so on. We'll move on then to item 1.3, which are the minutes of the meeting of the Council of Governors held on the 16th of November. And I'll ask for any points of accuracy or other matters arising on those minutes, please. I don't see any. Are colleagues then happy for me to Bex, you got in just in time.
Thank you, Mr. Chair. It's Bex Met, so Deputy Lead Governor and Service User Governor. It was just picking up on the point with regards to the attendance at Pride in Lincoln and the news that there will be a second Pride in Lincolnshire this year at Skegness for the first time ever, and asking the question to see if anybody knows whether the Trust will be attending both Prides this year.
I don't know the answer to that question. I wonder whether, Sarah, you might have a comment.
Hello, yes, Sarah Connery, Chief Executive. Thank you for your question, Bex. And unfortunately, I did miss the LGBTQ+ staff network, which was held today. But we make sure that we try and attend all Pride events. But I'll go and check that back with the staff network, and then I can feedback at the next meeting, or we'll make sure that we do a release so people can pop things in their diaries. But great to hear that it's going to be in Skegness.
Thank you.
Thanks, Bex. Any other comments or matters arising? If not, are colleagues happy for me to sign those minutes as an accurate record? Just a quick indication in chat would be great. Thank you. Fantastic. Thank you very much. The other thing I should have said before I ploughed into items on the agenda is that for reasons of time management of colleagues, I'm going to take item 3.3, which is the annual quality account report, immediately after item 1.7, because the officers presenting that need to be away before the end of the meeting. So I hope that's in order. People are happy with that. That said, let's move on then to item 1.5, which is the schedule of actions. There are two actions on the schedule, one closed and one complete. I must confess, after 3 years, I'm not entirely sure that I understand the difference between something being closed and complete, or complete, but there you go. Any comments on either of those two actions? Well, I don't see any, so we will move on to the minutes of the Board of Directors meeting on the 30th of November, which is item 1.6, and an opportunity for governors to ask any questions in relation to those minutes or make comments. So, Carol.
Hello, I'm Carol Hagan, Public Governor for North Kesteven. Yes, it's a comment really about the Chief Executive's report on page 3.114, the small item from the Chief Medical Officer Annual Report 2023. I understand that this is Chris Whitty, and I understand that this is a direct quotation. The annual report was published on 16 November 2023 and aimed to concentrate on improving the quality of life in an adult's later years rather than just the quantity. I found that a very strange sentence. I don't know whether it's semantics. I don't know whether it's clumsy. I hope it would actually mean as well as just the quantity. And of course, we're talking about age expectations. I feel it's a kind of loaded sentence as well. I think there's maybe a political narrative behind that sentence. I was wondering what, you know, LPFT's understanding of that sentence was as a parent of a adult with very complex issues. I was particularly struck by the clumsiness of that sentence.
Thank you, Carol. As you say, it's a direct quote from the Chief Medical Officer's document, and we might agree that it's clumsily drafted. So, the way in which I read that as the trust chair is that the priority is to maximise the quality of life of of older people. I don't read anything more into it other than an intention to ensure that people live healthily for longer. And that's certainly the gloss that as a trust we'll put on it. I hope that's helpful, Carol.
Yes, I've seen that Sarah's come online. No.
Sarah, did you want to comment on that or something different?
Yeah, it was on that, Kevin. It was just to say what our Director of Public Health, the terminology that we're sort of starting to use in Lincolnshire is like to add life to years and years to life. So it's an and. So if that helps, hopefully that's something that sort of resonates more positively with you, Carol. But that's the terminology that we're sort of using in Lincolnshire around that. Thank you, Kevin.
That's useful, Sarah. Yes, I like that terminology. Okay, thank you. And I have another point about these minutes on the Department of Health and Social Care visit on page 4. I just wondered what was meant by the word the coterminous nature of Lincolnshire.
Okay, so this is about boundaries of local authorities and other public sector statutory organisations. So we have a single upper tier authority, a single county council, and a coterminous police force, and other agencies operate on the same geography. So unlike other integrated care board areas where you might have more than one police force, more than one upper tier authority, and so on.
Okay, that's really useful. Thank you very much.
And the NHS organisations in the county have the same boundary too. So
excellent.
Amanda.
Thank you, Chair. Amanda Whitehead, General Carer Governor. I just have a couple of questions. So one is in point 116, and it's around the quality assurance. So if it's possible to have a little bit more depth and context around what the risks were and the actions that were taken for them.
So can you point me at which paragraph you're referring to? I know the numbers aren't the paragraphs aren't numbered, but
BD 23116. It's at the top, the quality assurance.
okay. So I think probably the easiest way to answer that question is to refer you to the board paper that's a discussion of. So that's on the website and in the public domain. So my suggestion is that you have a look at that, and if there are still queries, then we'll deal with them offline, as it were, Amanda.
Okay.
Because I haven't got that paper immediately to hand, and I suspect other board members will be in the same position. So I will ask Karen to follow that up with you, and help you locate that paper, and then if that doesn't address the issue, and then kind of guide you in the direction of someone that you can have a conversation with. Is that okay?
Yep, that's fine. Thank you.
Cool. Was that the only question, or did you have another one?
There was another one, but it might be the same answer. So it was around BD 23117 and the ward challenges and recruitment.
Mm-hmm.
If those have got solutions, or if the challenges are still ongoing for Ward 12, especially, and Castle.
Okay, well, I suspect we can answer that question, and I'll look to Chris Higgins to offer some comments on current staffing around Ward 12. Chris, if you can, I assume he's, because I can't see chat and a list of people around. So Sarah, no. I see that you've bobbed your camera on, so you might.
Yeah, Chris was at an evening event last night, so he's not with us tonight. Thank you, but no, I'm happy to take that.
I'm thrown there, Sarah, as I say, because I can't see the list of people on, and I saw Chris this afternoon, and he said he was coming, so I assumed he was.
Oh,
right. Okay, back to you.
Well, yeah. Okay, so it's workforce does remain our biggest risk on our corporate risk register, but it is an improving position for Ward 12 and Castle. I can't give the specific statistics, but all of the workforce metrics on those two wards are going in the right direction. So happy to provide a bit more of an update outside of the meeting.
Okay, thank you.
Thanks,
if Sharon wanted to come in, Sharon Harvey, around the establishment review, just to provide a bit more detail.
Don't know. I can't see Sharon indicating that she wants to come in. I do, though, have a comment from Di, so I'd rather take that first, if that's okay, Sharon. Sorry. You're on mute, Di.
Okay. New teams. Di Bailey, Chair of Quality Committee. Actually, Kevin, my comment was in relation to Amanda's first question, which was about the assurance report. So do you want me to
let's deal with that offline then, having made that offer, Di, sorry.
Okay, all right, okay.
Thanks. Sharon, did you want to come in with something on the establishment?
Thank you, happy to. So Sharon Harvey, Director of Nursing and Quality. It was just to confirm the discussion in the Board of Directors in relation to Ward 12 was as part of the annual establishment review, which helped us to realise that we needed to increase the staffing on nights, on the night shift. So that is in progress and happening, but happy to pick up a separate conversation, Amanda, because I know you've contacted me as well around the safe and therapeutic care model, so I can talk in a bit more detail then if that would be helpful. Thank you.
That'd be really good. Thank you.
Thank you, Amanda. I'm sorry if that was a bit of a scattergun response, but hopefully we'll pursue all of that. Daniel.
Thank you, Chair. Dan Fleshborn, Adult Community Governor. So I wanted to talk about BD 23-122. It's around the female PICU. And sort of the report suggests that may not be feasible or be going ahead. And I wondered which of the NEDs who would be assured that would be the right course of action.
So, Sarah, do you want to comment on where we are with the female PQ? But I'll answer the second question first. So the answer to the second question, Daniel, is that's a decision that would be taken by the board as a unitary board.
Oh, right. Okay.
So, you know, that's not a decision to be taken solely by execs. So that
Right.
I think picks up your second point. Sarah, do you want to talk to the first point that Daniel made?
Yes, I know that there was a discussion at our sustainability committee about this item previously, and it'll be one that we keep coming back to. And the reason why I say that is currently we have one female PQ out of area, which clearly wouldn't warrant a standalone unit for itself, or even a mixed sex unit on that sort of demand and capacity. What we are doing as a whole system is a whole sort of mental health bed strategy for the next 3 years. That will be for the whole system, including acute, etc., going forward, where we'll get under the skin of that a little bit more. But you know, we sort of go from, we've had 6 at any one point in time. Now we're at 1. It's been that way for a while. So it's balancing, making sure that we've got the right capacity in the system, but in a way that's sustainable financially and from a quality and recruitment point of view. So it's an ongoing conversation, but it's not an urgent one for now, given that level of demand.
Thanks, Sarah. Thank you, Daniel.
Is it okay to ask a second question, Chair? It's in under the same section.
I'd be disappointed, Daniel, if you only had one.
Well, I'd hate to disappoint you, Chair.
Yeah.
So around the dementia diagnosis review, in fact, it's just below. And while obviously the focus should always be on the person with dementia, totally agree with that. I wondered if that review also encompasses the support that's offered to carers as well, who support people living with dementia. And just for full disclosure, I work in the Lincolnshire Recovery College, and we are currently we are co-producing a course around carers. And it's one of, and in scoping for that co-production group, we noticed a gap where sort of carers aren't necessarily being supported in their own right with their own well-being, more as a package, if you like, as part of supporting the person with dementia. And I wondered if that was sort of part of that review, or maybe have a conversation away from the meeting to see what sort of what we could bring to that review from that sort of scoping exercise we've done for carers.
Okay, thanks, Daniel. Mark, do you want to comment on that?
Apologies, Kevin. Mine was linked to a previous item, so I'm happy to wait.
Okay. So I don't know the answer to your question, Daniel. Sarah.
I didn't know whether Jackie Tyson wanted to comment on that specific one, because she's put a comment in.
Only to reassure Daniel that carers are very much supported in the dementia pathway, and you may have seen comms recently where we've renamed our memory support service to encompass people with mild cognitive impairment, and that offer is to carers, not just people living with dementia or mild cognitive impairment. And it's mandatory when a carer or a patient comes through the dementia pathway. It's mandatory that our community mental health team offer a referral to the memory support service. It's an opt-out service, so every single person that comes through that pathway is offered support via the memory support service. So I feel very assured, as somebody who works in older adults, that offer is there.
That's great to hear. Thank you, Jackie.
Thanks, Daniel. Does that address your question adequately? Yeah, good. Thank you. Mark, I'll come back to you then.
Yeah, thanks, Chair, and good evening, everyone. I'm Mark Platts, Director of Finance, Digital and Estates. It was just to go back to the female PQ question, so a bit more context around that discussion, really. It's important as an organisation that if we start public consultation and start to look at options like that, that we can actually validate that the scheme is affordable. So what I have taken away from the meeting was we're doing a lot of financial analysis in the background with the finance team to make sure that we can have the capital in place, we can get potential costings and scoping, so we can add a bit of substance to the conversations, because the last thing we want to do is start to talk about something that may not be affordable or even deliverable from an organisational perspective. So just wanted to add that context into the question from Dan. Thank you.
Yeah, thanks, Mark. That's really helpful. I can't see any other questions on those minutes, so colleagues are content. I'll move on to item 1.7, which is comments from the chair. I've got one thing very briefly, otherwise I would be stealing the Chief Executive's thunder, and that is just to note my pleasure at having taken part in the groundbreaking ceremony for the new build at Norton Lee in Boston. It's personally very important to me, and it's really good to see work there motoring ahead, and it's a significant significant praise is due to the team that have got us to this stage, ensuring that the funding for it is secure and that we can crack on and build. So that's really good to see, and well done to everybody involved. With that, I will move on and take item 3.3, which is the annual quality account briefing. I don't know who's speaking to this, whether it's you that's kicking off, Sharon, or whether Lucy's kicking off.
I think if it's okay, we'll hand straight to Lucy, but just thank you,
that's
Chair,
perfectly fine, Sharon,
and colleagues for letting us speak a bit earlier on the agenda. We really appreciate it, but I'll hand over to Lucy.
Not a problem. Lucy,
yes,
thank you.
I echo those thanks. I'm Lucy Kent, Associate Director for Quality Improvement. What I propose to do is take the paper as read, but that there are a couple of areas that need agreement by the Council of Governors, so I'd like to sort of concentrate on those. So obviously it outlines the purpose of the paper, and then goes into the background, and basically we have a requirement to publish an annual account, and we have a time frame to do that. What there hasn't been now for a couple of years is detailed guidance from NHSE about what should be in the quality account. There's a frequently asked questions section, which is referenced in the paper, which gives minimal information, and we have historically been producing a very comprehensive report, and what we'd like to do this year is produce more of a streamlined account. We think that will make it more accessible to everybody. It reduces some of the reporting requirements on the organisation as a whole. We've discussed this with the ICB. They are in agreement with that. So subject to any other last minute guidance from NHS England, we would like to propose that. And that proposal needs the agreement of the Council of Governors, please.
Okay, thank you, Lucy. How do you want to approach this? Do you want to take any questions that
or shall I progress through and then come back?
I would do that. So
okay,
my preference is that you progress through the paper, and then I'll ask the questions for formal approval at the end. Okay,
lovely.
I should have made that clear at the beginning. Sorry.
That's okay. So then the paper then goes through the trust mandated and priority indicators for 2023-2024. We use the historic mandated indicators from NHS England, but then also determined local indicators under patient safety, patient experience and clinical effectiveness. All of the progresses against all of those will be detailed in the report, which should be out for wider review in March, which will be the normal process of Q1 to 3 data that goes out for consultation, and then we update. In terms of the priorities for 24-25, again, as I've said, there isn't this guidance, there isn't the national mandated indicators in the literature anywhere. So we've had quite a comprehensive discussion throughout the organisation about how we should
really make these priorities mean and reflect what is important to our patients, our carers and our staff. And what we have decided on and would again seek agreement on is that we have trust-wide priorities, and we have 4 of those, and we have a priority that each division leads, which is detailed in the paper. We haven't split them down into the 3 elements of quality, effectiveness, experience and safety, because we recognise that all of the priorities encompass all those elements of quality, so it felt a bit of a false delineation. So the trust-wide priorities that we propose is to continue work on risk assessment and formulation, that we have an overarching transition SOP and policy which gives clear guidance across all our services. We've been lucky to secure NHS England funding for Every Voice Guardian, so we want to really invest in that from a quality improvement point of view, but also build on the work that we've already done around patient and carer experience and look at what improvements we've already put in, have they made a difference? And we want to further do work on culture of civility, respect and kindness, because we understand that that underpins all the work that all our care staff deliver. And the divisions have want to propose to lead on adult community as dual diagnosis, adult inpatient and urgent care is least restrictive practice and therapeutic observations. Specialist services is about accessible services and reasonable adjustments, and older adults is frailty. And we feel that the combination of these 8 provide a really comprehensive improvement programme for the Trust taking it forward. That doesn't mean that other improvement work isn't happening, but this is what will get corporate support. So that's the area that needs agreement. And that's really the paper. The rest of it is just about it going out for consultation, as I say, in March, and then being updated with Q4 data and being submitted in June. Thank you.
Thanks, Lucy. Now, can we be absolutely clear what it is that the Council of Governors needs to approve?
Yes. So I need the Council of Governors to hopefully give their approval on the fact that we are undertaking a streamlined version of the account, to recognise that we haven't got the detailed guidance that we've had in the past. So that's the first one. And then the second one is around the priorities. We've not got nationally mandated ones, so we have taken the priorities from our own data and feedback.
Okay. So there are 2. Thank you very much, Lucy. So 2 specific questions. The first is whether or not the Council of Governors agrees with the overall approach that's being taken. And then the second is to sign off on the proposed priorities. So questions or comments, please, from colleagues. Daniel.
Thank you, Chair. Just to ask, really, were any other approaches considered? Obviously, we're looking at approving this approach or agreeing with this approach, but how did we get to this approach? Were others discounted, or has this just been the focus from the beginning?
I think what's been fed back over the last 2 years is the quality account has grown and is quite a lengthy read, and actually is that as accessible as we want. So following that feedback, I undertook sort of a search of other organisations and what they do, and it varies hugely. But there are definitely some that are more accessible than others in their format, and it was felt that we needed that. We have a lot of data in ours which other organisations don't supply, and I think that sometimes reduces the flow, the read, etc. We're also looking at some of the mandatory wording, which was very clunky in the past, that we won't be using that again to help the accessibility of the overall documents. But it is a case where there is huge variation between organisations.
Thank you, Lucy. And then just obviously, secondly, you know, because it's always have to. When are we expecting the guidance to come back again? Is it just gone forever, or you know, is this a blip?
On the website for NHS England, it was supposed to be reviewed for the 23-24 guidance. That's what they said for the 22-23 guidance. That's not happened. My understanding is it does require a change in law. So I'm just going with what we've got. The ICB signed this off for us, and I've linked with them to ascertain that that's okay in an approach.
Lovely. Thank you for your response, Lucy.
Thanks, Daniel. Bex.
Yes, I've already introduced myself earlier, Bex Met, so Deputy Lead Governor. It's just picking up on the Every Voice Garden. I just wanted to ask the question, is that a role that somebody will undertake in the future? And do I take it that to today's decision will look towards a recruitment of somebody?
So this is a really exciting opportunity. We've been given some funding from NHS England for 18 months in all, to actually be quite creative. It is around a role, but how that role is going to look will really depend on the feedback from patients, carers and relatives and staff, sorry. So we've started off, we have appointed somebody, it's a fixed term contract at the moment, but how that role looks may be completely different by the end, or whether it is a role or whether it's principals. It's really helpful to have been given complete freedom. We are looking to get external evaluation on the process as well, and there is potential that NHS England will use this as a pilot to whether this role will be recommended for future organisations. Sharon, I'm sorry. Thank you.
Thank you for that answer. It's very full.
Thanks, Bex. I've got, really pressed the wrong button then. I've got Amanda next.
Thank you, Chair. Amanda Whitehead, General Carer Governor. Lucy, it's just picking up a point under the mandated indicators, which is the memory assessment digital pathways. It says to support widening of the offer for patients with cognitive issues, and in brackets it says older people and frailty. But would that be looked at for younger people, because quite a lot of medications actually can seriously impact memory for those people as well?
Apologies, can you just direct me to where that, sorry?
Yes, for the papers that I read, it's right at the bottom in the columns. So it's under mandated indicators 22-23, and I believe it's under 23-24 as well.
Yes, so that was a priority determined by the older adult and frailty division. So it was only picked up by that division at that point. So that's not to say that we wouldn't look at that in a different opportunity, but for this piece of work, that was delivered by the older adults and frailty.
Okay. Thank you.
Thanks, Amanda. Di.
Thanks, Kevin. Di Bailey, non-exec chair of Quality Committee. I just wanted to come back on Dan's question, actually, Kevin, if I may. Lucy very helpfully outlined where we've looked beyond LPFT regarding the format of the quality report going forward to make it more accessible. I just wanted to come back in terms of the focus, because we spent quite a lot of time at Quality Committee in looking at the quality improvement priorities that we had for 23-24, in terms of making sure that we do focus and not try to do too much and lose that focus. So some of what you see under the trust-led priorities are what has come out of some of the significant areas that has been to Quality Committee. So, for example, the theme around transitions has come out of board stories from patient experience and some of the learning that we've heard at Quality Committee, particularly around patient experience and safety. And the culture of civility and kindness has also come out as a theme in terms of how we really listen. So I just wanted to add that context so that governors can understand really how we've had those conversations about where we focus. Thank you.
Yeah, thanks, Di. That's really helpful. Sharon.
Thank you, Chair. Sharon Harvey, Director of Nursing and Quality. Di's actually covered almost everything I was going to say, so I won't repeat it. But if I could just take the opportunity to commend both Lucy and the Central Quality team and the Divisional Quality Improvement and Assurance leads, because they've really thought hard about what these priorities would be, triangulated all the data and information, as Di had said, but have really taken ownership of these priorities, which I think is a real joined up shift for us as an organisation, and just wanted to make that note. But otherwise, Di's already picked up what I was going to say. Thank you.
Yeah, that's really helpful, Sharon. And it's, you know, I'm really conscious of the amount of work and the diligence that's gone into getting us this set of proposals. So, you know, echo your comments on that. I don't have any other questions or comments. So to the two specific questions, which is, you know, the more streamlined approach and the proposed priorities, can I ask that colleagues indicate in chat whether or not they're happy? I've got a couple of yeses to both, so you're off to a good start, Lucy. Yep, that's great. Lucy, thank you very much for presenting that, and thank you for the work that's gone into getting it to this stage. I'm really grateful.
Thank you very much. Thank you.
We will move on then, if we may, to item 2.1, which is highlight an exception report from meetings of the Nominations and Remuneration Committee on the 16th and 19th of December and the 8th of January. Debbie.
Hello, thank you. I'm going to suggest that we don't need to, well, we maybe need to, but we don't go into any specific detail on this paper. I'm hoping that everybody's had a chance to have a look at it, but we've actually got a very detailed paper later on the agenda at item 4.2, and maybe any queries could be raised then. If that's okay with the council, please.
That sounds very sensible, Debbie, because the substantive issues come up later on, don't they, on the agenda? Okay, I don't see anybody objecting to that, so
okay, thank you.
Let's proceed on that basis. Thank you very much, Debbie. In that case, then we'll move on to item 2.2, which is the highlights and exception report from the Council of Governors Representation Committee on the 8th of January. Bex, I think you're picking that up, aren't you?
Yes, sorry, just trying to bring my paperwork
That's quite
up
all right.
as well as being seen. Yes, Bex Met, so Deputy Lead Governor. I chaired the meeting on the 8th of January, and the papers before you are for information and request the governors to show that they're happy with those and any questions.
Thanks, Bex. Any questions or comments? No, I don't see any. Thank you very much, Bex. We'll move on then to item 2.3, which is Governor's Activity Report and By-Election Update. Samantha.
Thanks, Chair. So I'm Sam Swindell, I'm the Governor and Membership Officer, and in front of you is your Governor Activity Report and By-Election Update for 2023-24. The first part of this report is retrospective in terms of the Governor's activities carried out last quarter. It includes a bit of a brief description on each activity and for some activities feedback from the Governors. The second part of the report sets out an update on our current by-election for governors, And since writing the report, I can confirm that both Alexandra Jones Eckersley and Olivia Taylor have now joined the council as part of the by-election results. Uncontested, Olivia is standing in the staff older adult and frailty seat, and Alexandra is standing in the patient governor seat. We're also going to election on the 30th of January as well, in terms of the specialist service seat. So our votes are opening, and we've got 3 candidates that have stood for specialist services. So I'm happy to take any questions regarding the report. Otherwise, it's just for information and any discussion points that governors want to raise.
Thank you, Sam. Any questions or comments? Daniel.
Thank you, Chair. Just to clarify, I think I've read this right, that the young persons carer governor remains vacant.
It does, yes.
Is there a plan in place to try and fill that ongoing, or because I think I asked this question last time about needing another election if it remained vacant, and unfortunately it has done so. So is there anything we can learn or do differently, or do you know what I mean? Just to, because if we just keep putting it back out to election, I'm assuming we're just going to keep getting the same result.
Yeah, I think Dan, it's a really good question and really good challenge, and in terms of all the vacancies that remain still to fill, it wasn't short of having interest, because with the governor info sessions that I put on, between 10 and 12 candidates that are not included in the ones that have been elected or going forward, you know, decided not to stand for whatever reason, and that included an interest in the younger people seat as well. So that we can do some focus work around that specific seat, but generally speaking, there is always work to be done around all the vacancies. Ordinarily, we would wait until our next election for the summer, but there is always the opportunity to have conversations to hold election before. You know, that's not off the cards, but I think the strategy needs to be there to be able to, you know, bring in that interest. A lot of the interest that we got was that their decision not to stand was mainly based on time commitment and eligibility criteria. So there's quite a bit of work to do around that. But yeah, I'm happy to have those discussions, Dan, because it has remained vacant for quite some time. So thank you for asking the question.
That's okay. And just wouldn't mind just a quick follow up. How are we assured that those constituents' voices are being heard when there isn't a governor in place, and especially if it's over several different cycles, as it is for some of them?
Yeah, I mean, the governors that are in place, although they're not strictly speaking linked to the younger people seat, you know, we do still have 3 carer governors in place. So if there was to be anything raised, any ideas that come in or issues or those conversations needed to be had, we'd have those governors in place to be able to feed that back in. Ideally, it would be nice to have that younger carer governor on board, but we do still have the other governors. So in all the constituencies, we're still covered majoritively with governors, even though we've got those vacancies. If that makes sense.
It does. Thank you for that clarification.
Okay, thank you.
Thank you, Daniel. Michael, did you have a question? No, I think possibly not. Bex.
Yes, thank you, Bex Metso, Deputy League Governor. It was just a question about the meetings with yourself, and is anybody else involved within those meetings with potential people who are thinking of becoming a governor and applying?
Are you referring to the governor information sessions, Bex?
Yes.
Sorry, I'm not sure what your question is in relation to that. So I hosted them, and
Right.
we had candidates that came in that were interested, and they were advertised. Yeah.
The only thing was it wasn't a question. It was sort of a question asking if it was you hosting. That's great. But the sort of the comment was related to that, and that is there any mileage in the thought of actually having people who are governors currently involved in those sessions at some point?
Yeah, absolutely. And
which is what Karen's just supported
yeah.
me in the chat with.
Yeah, absolutely. I did actually ask, I think you was one of them, Bex. I did actually ask, not specifically for those info sessions, but when I went out to patient groups for you to attend with myself. And, you know, so there is definitely scope to open that up to the governor information sessions. And I can advertise that on our Governor's Fortnightly, you know, as we approach the elections. That's a really good idea.
Yeah.
Yeah.
Thank you very much.
Thank you, Bex. That's an excellent suggestion. Sarah.
Hi, Sarah Connery, Chief Executive. I just wanted to make a comment to our staff governors to thank them for taking time out of their busy days to attend the marketplace events during trust induction. In my Chief Exec induction sort of introduction piece, I talk about the value that we place on governors. So to then have them there in the marketplace is really helpful. So I just wanted to offer my thanks for their time and support with that. Thank you.
Yeah, thank you very much, Sarah. Okay, don't see any more comments on that, Sam. Do you want to move on to the iLog?
Yeah, of course. So again, the iLog report is for governors to receive and have any relevant discussions, and it includes all the issues and ideas that have been raised in the past quarter and what their progress is in a you said we did format. So unless I've got any questions that to take on those two.
Carol.
Just two very quick comments. I like the fact that the initials of the governor that's raised the iLog has now been dropped, because that makes the iLog more confidential. I found the 06 log quite interesting, because it could be that those children who actually have neurodivergences might not actually be attending school. So that's an interesting one, isn't it? If a referral needs two referrals, as it were, it may be that the child isn't actually attending school. So I think that is a really good iLog.
Thanks, Carol. And the heads of service on that particular iLog are you know, feeding back really well in relation to further questions as well. So yeah, thank you.
Thank you, Carol. Daniel.
Hi, thank you, Chair. Just a really quick question about process. So iLog 2023-02. So was it reopened just to give the person that information and to signpost them and then closed again? I wasn't entirely sure how that process worked and if, you know, why it was reopened.
Yeah, so why it was reopened was because we'd had a response and that person that raised it wanted to have further information, and they wanted to reopen it. They weren't happy with the response that we went or the direction in which we went. So we changed direction, and now that I can assure you they are very happy because they've closed it. So yeah.
Thank you. That's just a great sort of showcase of listening to those responses and not just, you know, here's your response and closing it. So yeah, that's good to know. Thank you.
Thanks, Daniel. I don't see any more comments or questions, Sam. So really grateful for both those items. Thank you very much.
Thanks.
We'll move on then to item 3.1, which is Chief Executive's report. Sarah.
Thank you, Kevin. Hello, Sarah Connery, Chief Executive here at the Trust. So just to point out to our governors, in response to some feedback that the report was quite sort of wordy and lengthy, I I held myself to account diligently to keep to 4 sides of A4 in my Chief Executive's report, so a bit of condensing down. So I hope our governors sort of find it a bit more accessible. You'll notice I've changed the format so that it flows in line with our trust strategy. So sections on healthy population, quality people and best use of resources. Just a few things to flag. I was going to talk about the Every Voice Guardian, but Lucy's already picked that up. But they are in post. It's Louise Bannister, who was the ward manager on Francis Willis unit. So some of you probably know and have met Louise, and she's already having a really positive impact on our services. So a number of us have signed up to do a sort of come dine with me experience where we'll sit with patients. We've had some feedback that the quality of the food is that we have on offer on our inpatient wards can be variable and sometimes leaving people hungry. So we're actually going to experience that firsthand as a patient and build that into our responses going forward. We've just wanted to point out about the patient and carer race equality framework, or PCREF. You'll be hearing a lot more about this going forward. Something that we've never really been great at in the NHS and in LPFT is making sure that our services are accessible to all of the communities that we serve, and there are inequalities in terms of access, experience and outcomes for some racialised communities. So this is about understanding our data and making sure our services are accessible and culturally sensitive. So watch this space on that. Just a bit of a heads up that we're doing a review of the Vales, which is one of our mental health rehabilitation female wards. So Joe's going to put the link in the chat in terms of how you can get engaged in that really important piece of work. So we just want to make sure that we're offering the right pathway through that ward to meet the needs of our communities going forward. Unfortunately, the psychiatric intensive care unit does remain temporarily closed. We're having to do a bit more testing around Legionella, but hoping to make sure that we can have that open early doors as much as possible in February, because we have 5 males out of area due to the sort of ongoing issues with Legionella there. As Kevin pointed out, we have broken ground at Norton Lee, which we're absolutely delighted with. I do reference here in quality of services around, we have expanded our mental health urgent assessment centre this winter for children and young people as well. With the opening of the new wards, it freed up some estate to make sure that we could offer a safe space for children and young people, as well as adults at the Lincoln County Hospital site. We've also done a business case for a mental health urgent assessment centre in the east of the county, which will require revenue and capital investment, but that's going through the relevant processes now. So I'll stop there, Kevin. I'm more than happy to take any comments or questions that people might have.
Thank you very much, Sarah. Daniel.
Thank you, Chair. So just around the PICU part, really, I think it's fair to say it's been difficult for all involved. But just in my recent time as a community adult community governor, I think it's important to say that the feedback that you've given to staff about and kept us in the loop about what's happening has really supported morale. And I commend whoever it is who's been given those updates, that actually, you know, that makes a big difference to staff. And I think that's worthy of pointing out. And just to really ask, how is this just a one of those sort of things, or the things, or are the things that we can do? Because I remember sort of coming back after work after the Christmas period, you know, we'd all requested to run our taps for a bit, that kind of stuff. But are there more practical things that we can do to really support you guys and everybody really to keep our facilities as open as possible?
Yeah, thank you for that, Dan. And Joe Walker, our head of comms, will be furiously blushing now at your positive feedback. So Joe, make sure that we are sending the right messages at the right time to keep people. So thank you, Joe, for all that you do to make sure that staff are appropriately communicated with. There will always be lessons to learn through any of our temporary closures going forward. We've all learned a lot more about Legionella through the process, I have to say. Hence why, you know, we've done that message to staff to say, you know, when you come back in, offices might have been closed for a while, do run your taps. It is a low risk, but obviously we have to put patient safety and staff safety absolutely priority and not take any risk there. So I don't know if Mark wanted to come in and talk a little bit more about the learning from the processes so far. Sorry to put you on the spot there, Mark.
No, it's fine. Thanks, Sarah. So, afternoon, everyone. Mark Platt, Director of Finance, Digital and Estates, and Dan, thanks for flushing the taps and working that forward. I must admit, since I've been learning it, even at home, anything more than a couple of weeks, you're flushing it through. But yeah, I mean, in terms of learning, you may all see this when you pour a drink at home, that the water in Lincolnshire is challenging to work with. So, you know, a lot of our buildings do have filtration systems built into them that really minimise that. So, you know, the new builds, whether it be Discovery House or Ellison Castle and on site, they're fully prepped for that, and it's an automated process. That I think the challenge we had with the specifics around the PQ and the whole car home site was COVID compounded onto not using the site. It was an aged site, so a lot of the pipe work and that had been there for many decades, really. So the full refurb has really brought the cases down. We've got new water tanks in there and everything like that. So it's about maintaining our estate, but where we do have a water safety group that meet on a regular basis. They keep records of all counts or anything that we need to be aware of, and will proactively go out and keep filtration and taps moving as we need to. So always lessons to be learned, but there was a uniqueness around the specific site and the consequences of coming out of COVID. But thanks for the note.
Thanks, Mark. Thank you, Daniel.
Thank you.
Any other comments or questions for Sarah? No, I don't see any. Thank you very much.
Thank you,
Sarah.
Kevin. Thank you.
We'll move on then to item 3.2, which is the performance assurance report, and I hand over at this point to Di.
Thanks, Kevin. So Di Bailey, non-exec, and presenting this performance assurance report in my role as Deputy Chair. Since the last meeting of the Council of Governors, we've had a look at the governance structure, particularly in terms of including the new performance committee going forward, and colleagues will see in the forward section to the report, there's an explanation about the performance committee in there, just to outline how that sits in terms of the structure. And of course, coming to the next Council of Governors will be the first performance assurance report to reflect that new structure going forward. Just to remind colleagues as well that this report is backward looking, it's retrospective, so it may well be that as we go through each section, non-exec colleagues will want to just give an update where there's been progress on some of the areas that are highlighted. So on that note, if I just go on to the quality section of the report in terms of my role as Chair of Quality Committee and the non-exec analysis that you will see there, just to say a little bit more on the items that are there, I think just to help contextualise things really. We've done quite a bit of work at Quality Committee around the structure of reports from our executive colleagues, particularly to make sure that we align those reports with the key risks that Quality Committee are looking at. And this is the point about the quality assurance. And I think we've seen a real improvement in terms of those executive reports around those risks in terms of getting good quality assurance going forward. in terms of the patient experience and the patient voice at the committee, we recognise that we've got more to do, and already in this meeting we've talked about the Every Voice Guardian, and the expectation is that that will feed into Quality Committee going forward. In the interim, what we've been doing is to try and bring through the patient voice from feedback that we've had, both positive and negative, and the comment there that you see in terms of the analysis is about how we've been looking at that feedback and thinking about how we can amplify that. And in order to do that, we've got a development session for Quality Committee happening on Monday, which will look again at the governance structures and the subcommittees that sit beneath Quality Committee to ensure that we really get that read across from patient experience. I just wanted to highlight, I've mentioned already in my comment about the quality report, about the thematic learning from some of the board stories that we've had and the serious incidents, and how we've been using that in terms of ensuring that that underpins the quality priorities going forward. But finally, I just wanted to flag the report that came to Quality Committee and went onward to board about the relationship between our vacancy position, our workforce, which is our biggest risk, and the impact of that on quality. And what this highlighted, as you might expect, was that there is a real complexity of those relationships. So it's not as straightforward as saying, well, if we've got a number of vacancies in one area, then automatically quality of care is affected. And we've really understood that in some detail. This is a key example, I think, of an area that would go forward to Performance Committee in the future, so that we can look at where we can then influence the factors and the levers that are playing into those relationships to really make sure that we do the right things to have an impact on performance. So I think that was a really useful piece of work from a range of perspectives, but thinking ahead to how Performance Committee might work in the future, that this is the kind of example of the sorts of things that we would be looking at in that space. So that was all I wanted to say on quality, Kevin. I don't know whether there's any comments or questions from colleagues at that stage. If not, I will hand over to my non-exec colleague, Tim, who I believe is picking up the Sustainability Committee section of the performance report.
Yeah, thanks.
So I propose, Di, sorry, that we conclude the comments from non-execs, and then I'll take questions and comments on the totality of it. But sorry, Tim.
No problem, Kevin. So Tim Harry, non-exec director, and presenting the Sustainability Committee material on behalf of Chris Wright. So I think to highlight, we had continued strong assurance around the trust management of its spend versus budget, but there were two budgetary factors which present a challenge to us, and they're today's challenges, as you might say. One is around the level of agency spend, which continues to be higher than we'd had planned or wanted. And one of the things that we're doing around this is, and it exhibits the cross-committee work that we need to do, and some of this will feed up into the Performance Committee. These are the agency spend are in particular in the specific areas, so we need to have a look at from the People Committee perspective around recruitment, retention, and why there's still a reliance on agency staff. So that's a piece of work that needs to be kept an eye on. The other thing is really a slight irony in some respect, in that the recruitment levels that we've achieved so far are actually higher than we had actually planned. So it presents it's a nice problem to have, but it is a problem again that we need to keep an eye on. So I think the main message really is that whilst there are challenges, they are manageable at present, and we know we've got to keep a close eye on those. The only other thing I really wanted to raise was a longer term challenge that we have, which is around the context of the trust having increased demand and how we can ensure that we have sufficient resource which is managed in an efficient and effective manner. One of the key things that we're doing is looking at demand and capacity. So there's a series of assessments being done. What that will do is provide evidence for where we believe we need to be in terms of resource. So that may well challenge some of the existing vacancies. Are they truly required? But it will also help demonstrate where there may be a funding issue, and therefore it all provides evidence in that sort of context. If I can move on to the People Committee. So obviously as chair of the People Committee, in September, the theme of our deep dive was around training, learning and development. And we heard some really good news and assurance around the areas of the quality of the leadership programme. And I can personally testify to that. I've attended a couple of the sessions and they really are good quality. The level of compliance that we have with mandatory training. And then finally, the apprenticeship levy work, which has been outstanding. Now, that's not to say that there aren't still challenges. One is around, you're always going to have a challenge around access to training. People are busy, etc. So we need to work closely at a divisional level to see how we can perhaps do things differently. The other thing is around addressing variation in leadership. Things crop up which highlight that perhaps the leadership isn't quite what you would want, and therefore there needs to be help in that sort of area. And I think the other thing around leadership is the quantity of people who go through the leadership programme to form a critical mass, and that will help with a cultural shift in the longer term. As Di said, we've had subsequent meeting in November. And just to touch briefly on there, we gained a lot of good assurance around the delivery of the people strategy. Again, not without challenges around resources, but we heard the mitigations in place. The other thing that we did at that session, and we made it a slightly different meeting to the norm, is that rather than having a deep dive area, we focused on the people strategy and also the BAF. So looking at the risk to delivery of the strategy, etc. And we wanted to do that because of the change in template, the new content, and we really wanted to spend some quality time and quantity of time to actually address that, which we did, and we gained assurance around how that was going and developing. So I think that's it from me.
Thanks, Tim. I think it's Ian now.
Yes, thank you, Di. Yeah, Ian Orrell, non-exec director and chair of the audit committee. You'll probably be pleased to know I've not got too much more to add to the couple of paragraphs that are in the report. The first paragraph there talks about some of the standard type of work that we were considering at the last audit committee, and makes reference to the BAF being the first version of the BAF that we'd seen at audit committee. The second paragraph starts off with it on a less positive note, where I made reference to the position at the time, which was that we weren't being as responsive as we should have been really to internal audit recommendations. I do say in the note that I was expecting that position to improve, and I'm pleased to say that we had an audit committee meeting this morning, and that position has, as I expected, improved. So that's the good news, and I'll be reflecting that point in the next report that I provide to you. So other than that, I think that pretty much concludes my comments, but happy to take any comments and questions.
Thanks, Tim. Kevin, I assume you're coming back in now.
Thank you very much, Di. I haven't got anything to add to the comments of colleagues. A couple of comments in the paper bringing it all together, which I'll take as read. So I'm happy now to take any questions or comments from governors and other colleagues. Daniel.
Thank you, Chair. Just a question for Tim, if that's okay. So, and an additional, because he said something that sparked my imagination. So my original question first, though. So in the where was it? The Pulse Quarterly Survey. So, Tim, how are you assured that you're getting a in quotation marks good enough picture, given the low 20%, 27% sort of return? By its very nature, that's only a quarter of, just over a quarter of sort of results that we could achieve. So, yeah, I'm just wondering how you sort of square that kind of circle.
Yeah, thanks, Dan. It's a good question, and I can't remember if it was in the paper or not, but we're not alone in this place in that the quarterly return is low. It seems to be everywhere. We're slightly higher than that. I think there's a bit of triangulation that's required around this. So rather than just relying on the survey, there's other elements, freedom to speak up, etc., where we can pull together other information, other lenses on some of the issues that we know exist within the main survey. And I think, sort of looking ahead, what we'd really like to do is probably have a focus on fewer elements, the really important things that came on an annual event, follow those up through the year, not necessarily on a quarterly survey, but of course this is mandated at the moment, and just focus and get assurance around those sort of key issues that were raised previously.
Thank you, Tim. And then in the second part it says about the frequency remains a concern. I didn't realise that. Can you expand on that, what that concern might be?
Yeah, it really just picks up the point I was making, that having it on a quarterly basis when you've done an annual one, that there appears to be a little bit of survey fatigue. So that's really the point about the concern.
Right. Brilliant. Thank you. And then when you were speaking just a moment ago, you said that there is not an issue, but possibility of having to look at sort of the recruitment being higher than expected. Do you mean there's a financial consideration because we're employing more people and that's not built in?
Yeah. So it's almost being a victim of our own success, that some of the strategies we've undertaken for recruitment have worked better than we had anticipated. So hence it's a nice problem to have. Provided we were recruiting the right numbers and the right quality of people, etc. But you have to ensure that you maintain a financial alignment. So you've always got to keep an eye on it.
Brilliant. Thank you, Tim.
Thanks, Daniel. Any other questions or comments? Well, I don't see any. So in that case, then we will move on to item, and I should thank my non-executive colleagues for presenting that report. Di, thank you for talking us through it, and thank you to colleagues. I think from my perspective, it demonstrates really well the Council of Governors holding non-execs to account. We've got to a position where my non-executive colleagues are presenting what I think is a really comprehensive account of the activities that they undertake to provide assurance to the board around the areas that they're responsible for in their respective committees. I think that stands up well, given the council's responsibilities in terms of accountability. So thank you, colleagues, for presenting all of that. So we move on to item 4.1. Which is a report on the performance of non-executive directors, and I'll take the report as read. and invite questions or comments. Carol, I note your point about a comfort break. I'm about to disappear after this item, and there's one substantive item. So I was heading for the finishing line, as it were. So we'll get to this item, and then I'll disappear, and then it will be up to Debbie, who will take the chair after me, to decide whether or not to have a break. So I'm not ducking responsibility on that. Daniel.
I just wanted to, both personally and I'm sure on behalf of the Council of Governors, to really thank all of the non-executive directors for taking the time out to introduce, and yourself, Chair, because you did one as well, to introduce yourselves, to give us that different and opportunity, I think, really to get to know who the the non-executive directors and the chair is, a bit of what makes them tick, you know, sort of what it is that not only just interests them professionally, but also a bit about the person behind the title. So to all of you, thank you very much. They're so welcomed. Please can we keep doing that?
Every intention to do that, Daniel, and if I'll let you into a secret, I really enjoyed doing them, and you know, they've been really valuable conversations, and I think that, to your point about getting to know NEDs as people, same with any other senior leader in this or any other organisation, it's absolutely critical, isn't it? Because it helps to understand motivation and so on. So, you know, I think it's really important, and I'll continue to do them until people get bored with it.
Thank you.
Thanks, Dan. Bex.
Yeah, it was just backing up on what Dan had just said with regard to the NED meetings, and I just wanted to say to some governors that are on the call that may not have been governors at the time or may not have been able to make the sessions, that they have been recorded and they could be watched online.
Oh no, if I'd known that they were being recorded, Bex, I might have said something different.
I think you were asked.
No, I'm joking.
I'm fairly sure of that.
Thank you. If there are no other comments on item 4.1, I'm grateful. Take that report as received. At this point, Debbie, I think I need to hand over to you to take the chair, and Tim, Di, and I need to disappear. Just to make sure, Debbie, that everything's all right before I do so.
Yep, can't see anything.
Okay.
Right, lovely.
Okay, I'll disappear then. Thank you very much.
Thank you, Kevin. So we've got quite a detailed paper now, item 4.2, and to help us with the all the different aspects of this, I'm going to invite Karen to take us through it, because I know we will have looked at it, but it's an important paper, and we do need Council Governor's views on this. So Karen, can I go over to you, please?
Thank you, Debbie. I'm Karen Scott, Head of Corporate Governance. Debbie's absolutely right. This is an extremely detailed paper, and rightly so. There's some really important decisions for the Council of Governors to make this evening about a number of very senior appointments. Yeah. Hopefully the level of detail is self-explanatory, and what is hoped for in it is that a lot of what is being considered by the Nominations and Remuneration Committee as delegated by the Council in overseeing all of these processes is extracts from the reports that they've considered and their views, and that text is reproduced in italics. So just to differentiate between and highlight what has actually been seen, and in true transparent style. So Debbie, I'm not sure how you want me to approach this. Would you like me to go through each and all of the appointments, or would you like me to consider one by one and for you to seek the Governor's views, comments, questions or approval of each separately?
Yeah. I'm conscious of the request for a break, but also that this is the last substantive item on our agenda. I actually think it would be simpler though if we took each separate item and then we got an indication from the council on each item rather than the whole paper as a whole.
Okay, thank you. That's really helpful, Debbie. And hopefully, given the level of detail in the paper, it has been understood and it is clear. So I will just summarise. So the first decision for the Council of Governors to consider is the appointment to the currently vacant substantive non-executive director vacancy. And you'll see in the process that was undertaken, there are actually two processes attempting to appoint substantively. On the second occasion, we were successful in identifying and recommending a suitable candidate, and that candidate is Dr. Sarah Whiteman. Details about Sarah are contained within the paper, and the Nominations and Remunerations Committee was unanimous in its decision to recommend her to the council for the appointment for a 3-year term, subject to receipt of references. I can confirm that all other checks required under the NHS England Fit and Proper Person framework have been carried out and passed. So yes, it would be from the 1st of February this year for 3 years. So over to council for any questions.
Thank you. Perhaps you could indicate in the chat, please, if there's any comments, questions, or if you're happy to agree this, please. Just waiting to see if anything appears in the chat, Karen.
Debbie, I think Jackie Tyson has put a comment. I'm not sure if it's specifically about this element of the paper.
Okay, no, I can't see that. I've got several agreements coming through, but I can't see Jackie's comment. Perhaps you could read it for me.
She hasn't made a comment. She's just put a C. Sorry, she's put a camera on. I think she'd like to make a comment, Debbie.
Thank you. Jackie, can we invite you in for your comment then, please?
Yeah, thank you. So Jackie Tyson, I'm staff governor with the Older People and Frailty Division, and I've been lucky enough over the years as a governor and more recently been involved in the recruitment process for these positions. And firstly, I would urge any governor to get involved in this process because it's absolutely fascinating. And I think you would be very assured that by the time we get to this point in the process where we're asking the council to agree, it has been so robust and so thoroughly explored. I've never quite seen an interview process like it, and I think the fact that we were all unanimous in this candidate's application speaks volumes because it is a very tough process, but overall I would recommend, yeah, and absolutely credit to Karen because she guides all the governors through this process, and it is a really admirable part of the role of governor that you get to sit on this. So I would agree to all the recommendations in this report, but really urge my colleagues, other governors, to get involved in this process because I think you would find this part of the meeting much easier if you understood how we reached this point.
Well said, Jackie. Thank you very much. Excellent comments, which I completely agree with and wish I'd said them myself. Thank you. Yeah, everybody seems to be in agreement with that then, Karen. So, Bex, did you want to comment before we move on to the next section?
Yeah, I was just going to say in relation to Sarah, I was involved in her final interview and I can't recommend her enough. She's a very good candidate for the role.
Thank you, Bex. That's very assuring. Good.
Thank you, Debbie. Shall I move on? Can I just recap? I've seen all of the comments and everyone's agreement in the chat, but for the benefit of anybody observing the meeting, members of the public or members of the trust, just to confirm that the Council of Governors has approved Dr. Sarah Whiteman's appointment as a non-executive director.
Thank you.
Thank you, Debbie. So if I could move on now to the recruitment for the position of Trust Chair. Again, hopefully straightforwardly set out, although detailed, but actually does set out what the options were that the Nominations and Remuneration Committee considered in some considerable detail. As it sets out in the paper, the Trust Constitution does provide the facility for the Trust to be able to consider reappointment of the existing Trust Chair and non-executive directors for a second term of office. And that was one of the options that was considered by the committee. As you'll see, and the rationale for its recommendation at the bottom of page 5, the recommendation is to reappoint the current Trust Chair for a second 3-year term commencing from the 1st of May this year, ending 30th of April 2027. Pass back to you, Debbie.
Thank you. Again, if people could put in the chat, please. We're getting some agreements, but we do need to hear from a few more of you. Thank you. Thank you.
That's great. That's great, Debbie. It looks fairly unanimous there.
It does indeed.
Still coming in. Thank you. So to confirm, just to recap, the Council of Governors has approved the reappointment of Kevin Lockyer as Trust Chair for a second 3-year term of office. Thank you. And finally, but no less important, is the recruitment process for 2 non-executive director positions which become vacant at the end of April this year. They are the current incumbents, Di Bailey and Tim Harry, expressed a desire to actually have a second term of office in the same way that the Trust Chair did. Exactly the same process and detail considered by the Nominations and Remuneration Committee, and the recommendation is to reappoint both individuals for a second 3-year term of office as non-executive directors.
Thank you very much. Again, if you could indicate in the chat for us, please. And we're getting agreement with that again, Karen. Thank you.
Thank you. So to recap, Council's approved both of those individuals' reappointment.
Yes,
can I then, thank you, Debbie, can I then, with your agreement, chairing the meeting, Debbie, suggest that I actually, rather than us invite them, all 3 of them back in, having left and nothing else in the meeting, that on your behalf, I actually contact each of them individually and let them know the good news. Thank you.
Thank you very much. If you could do that, please, Karen, and also just stay with us while we finish the meeting, because it might be helpful just to check out with you. We need to check item 5, items to note. I'm not been informed about anything for that item, so I'm assuming there's nothing to raise on it. And on item 6, any other business, we've not been pre-notified about any other business.
No, for formally advised. So just if anybody has anything, Debbie.
Can I just check, is there anything that we've not covered on the agenda that we need to discuss here in the light teams?
I can confirm every item has been covered, Debbie.
It has indeed, yes. It looks like that's all sorted then. So I just confirm that the date of the next meeting is Thursday, the 25th of April. And thank everybody very much for their contribution, and look forward to seeing you at the next meeting, if not before.
Thanks,
Thank you.
Debbie.
Thank you, Debbie.
Thank you, guys.
Bye bye.